This webinar is a part of the Health in All Planning Policies project supported by the Iowa Cancer Consortium. And I'm Allie Bain from the Iowa Cancer Consortium, and I'll be hosting today's discussion. Today's webinar is being recorded and will be available on the consortium's website at www.canceroiowa.org. During today's webinar, we will be hearing from Denise Atard-Sacco, a public health consultant who will briefly discuss the Health in All Planning Policies project and share a resource that has been developed. We'll hear from Gary Taylor, who is the Interim Director of the Community and Economic Development Program at Iowa State University Extension and Outreach, and an Associate Professor in the Community and Regional Planning. His presentation is titled A Primer on Local Land Use Decision Making. And finally, we'll hear from Mary Rose Corrigan, a Public Health Specialist for the City of Dubuque, and Laura Karstens, who is the Planning Services Manager for the City of Dubuque. And they will share how they partnered to complete their Community Health Needs Assessment. So just quickly, before we get started, I will just go over some of the features of the webinar. In the top right-hand corner, you will see a Files box where you can select a file and download it directly to your computer by clicking Download Files. These files will be mentioned by the presenters throughout their presentations. In the middle, you can see the attendees box of everybody that is joining us today. And in the bottom right-hand corner, you will see the chat tool where you can interact and ask questions. You can ask questions throughout the webinar, and then we will answer those at the conclusion of all of the presentations. So let's go ahead and get started, and if everyone would type into the chat tool what organization they are from so we can get a feel of who is on the call, that would be great. All right, Denise, we're ready for your presentation.
Thank you. So good morning, everyone. Thank you all for joining us today for our third and final webinar in this series that forms part of the Health in All Planning Policies for Iowa project. This project has been supported by the Iowa Cancer Consortium and the Iowa Department of Public Health. As you may already know, over the past year, we conducted a number of surveys with members of the Iowa chapter of the American Planning Association, the Iowa Public Health Association, and the Iowa Environmental Health Association, and with the aim to identify their learning needs with respect to the Health in All Policies concepts, associated tools, public health terminology, and even planning terminology. And we have tried to address the needs that we identified through this series of webinars. In addition, we have also compiled a 29-page document, which you can see mentioned on the slide, which is available today on this webinar for download. It's in the top right-hand corner, and it's called Health Planning Terminology. This document contains a glossary of planning terms, as well as a glossary of public health terms, and also some examples of cross-sector collaborations with health focus taking place across the state of Iowa. There are 12 cross-sector collaborations mentioned in there. We encourage you to go through them and make connections. There are contact details for each project. So if you are interested in learning more about each initiative, you can easily get in touch with the persons concerned. I want to thank all the folks that contributed towards the drafting of this document. I encourage you to download the document, and with that, I pass the floor to Gary. Thank you.
Thank you, Denise. Oops. My part of the webinar today is to talk about land development processes. And to put this in context, as Denise said, I'm working off of the surveys that were conducted by the APA Iowa chapter and the other folks as part of this project. There were a number of terms that were identified by people in the public health professions that said, you know, this planning process, this land use planning process would make more sense to us if we knew what these terms meant. And so using that as a baseline, my presentation is going to be about where those terms fit in to the land development process. As it was said, this is really a primer on the land development process. I'm going to quickly go through an overview of how the various pieces of the land development process puzzle fit together. I'm not going to talk about specific policies that work their way into the land use planning process, but how the various policies translate into action at the local level. And that doesn't make any sense to you right now, but as we work through this process, hopefully it will make more, it will come together. And we're going to do all of this in 20 minutes, so please be seated. The first question. Several people, as part of the survey, question, what is the comprehensive plan? We hear discussion of the comprehensive plan. What is the comprehensive plan? How does it fit into the process for decision making at the city or county level? So when someone comes in to a city office and says, we'd like to create a new subdivision, or we would like to build a little commercial building on the corner near downtown. How are these decisions made? What is the basis for the city saying yes or no to any particular type of development? It really goes back to this document called the Comprehensive Plan. The Comprehensive Plan is what it sounds like. It's a policy document that is developed that is basically a comprehensive examination of existing conditions and the trends in the community. It usually or should involve a careful citizen input process so that all of the citizens, all of the members of the community are heard from with their ideas and concerns for the future of the community. It's intended to provide a vision for the physical development of the community over the next 10 to 20 years. As such, it is intended to act as a guide for day-to-day decision-making by city officials. The comprehensive plan should act as a guide to the ordinances and the resolutions that the city or county develops that regulate land use. It should also act as a guide for funding decisions. If a community, for example, wants to incentivize downtown rehabilitation of older buildings to promote adaptive reuse or other types of projects, the comprehensive plan should reflect those policies. The comprehensive plan would say our policy over the next 5 years is to stimulate redevelopment downtown. And as I said, it's also a guide for making decisions on the day-to-day development proposals that come into the community. Your typical comprehensive plan, as I said, is a pretty thorough look at the existing conditions of a community. It's a look at the demographics of the community, population, employment trends, economic conditions, and projections into the future for each of those. It has elements on looking at the housing stock, the quantity and the quality, the needs for housing and the needs for affordable housing, transportation, infrastructure, environmental conditions, and existing land uses, and which include residential, commercial, industrial, agricultural, open space, and public land uses. Those are generally reflected in an existing land use map that is part of the comprehensive plan. After this look at the existing conditions, the comprehensive plan will also contain a set of goals and objectives that are related to those previously identified issues. What are our goals? What are our objectives for how the community develops over the next 20 to 25 years? Where should commercial development go? Where should residential development go? What is the appropriate density of residential development in any given part of the community? And then more broadly, questions of community design. What do we want the community to look like? How do we want the pieces of this puzzle to fit together? And again, goals related to housing, transportation, economic development, and environmental protection. As I said, there's generally a future land use map associated with it. Let me back up. There is an existing land use map that shows the current build-out status of the community, but there's also generally included a future land use map that says in 10 years, this is what we would like our community to look like. This is where we see development taking place in undeveloped parts of the community. This is where we would like to see more density created. This is an appropriate place for parks, so on and so forth. And as part of the comprehensive plan, there's going to be a set of implementation steps and action strategies for getting where you want to go in 10 years, 10 to 20 years. Now, a lot of this is reflected in the Iowa Code. Back in 2010, the Smart Planning Act was adopted by the Iowa legislature. Section 18B.2 of the Iowa Code actually lays out, it doesn't mandate what should be included in a comprehensive plan, but it does give a list of preferred comprehensive plan elements and the type of analysis that should go into each of those elements so that you know that you're working off of the best information and making informed decisions through your comprehensive plan. A lot of the terminology that you will find in the health planning terminology book or booklet that is one of the files up in the top right corner. A lot of the terminology is actually reference to specific policies themselves. These are the types of policies that would be reflected in the goals of your comprehensive plan. So adaptive reuse, for example, in the book says converting obsolete or historic buildings from their original use to a new use. If that is a goal, or an objective of your community, that would be reflected in the comprehensive plan. The same with complete streets. Complete streets is a notion that roadways should accommodate all modes of travel. So not only the car, but the bicyclist, the pedestrian, transit. The design of the street should accommodate all modes of travel. And if that is a goal of the community, generally that goal is reflected in the comprehensive plan. The same way with the rest of these terms. Another way to think about it, also referring back to the SMART planning principles, or the Smart Planning Act, there's another section of the code, 18B.1, that says, here's a list of 10 ideal goals that communities should strive for in their land development patterns, or in their land development policies, I should say. Collaboration with other communities in making land use decisions, efficiency, transparency, and consistency of land use decisions, a goal of promoting clean, renewable, and efficient energy, goals of occupational diversity, revitalization of existing built environment, housing diversity, and you can read the rest of the list. So these would also be goals that would be reflected in the comprehensive plan if they are the wish of the city and the city and its residents. So if a community has a comprehensive plan in place, that's great. Every community should have a comprehensive plan in place. But a comprehensive plan only gets a community so far. The Iowa Code says that zoning ordinances and zoning decisions shall be made in accordance with a comprehensive plan. So the Iowa Code ties local zoning decisions back to the comprehensive plan. And that's important. I think I got out of order here. And that's important because the comprehensive plan itself is not the law. The comprehensive plan is a policy statement. If a community has a comprehensive plan, but they do not adopt a zoning ordinance, then you won't see any of the goals that are set out in the comprehensive plan show up in the built environment. The built environment is regulated by the zoning ordinance. Same is true if you create a comprehensive plan this year, but you have not updated your zoning ordinance since the 1970s, which there are many communities out there that it may be 10, 15 or more years between times they update the zoning ordinance. If you don't update the zoning ordinance to be consistent with that comprehensive plan, then you're going to get development patterns that the community wanted back in the 1970s or back when the zoning ordinance was last updated. So the plan directs future land use, but the ordinance regulates land use today to see that the goals of that comprehensive plan actually make it into reality on the ground. So what is a zoning ordinance? In its simplest form, or in the simplest way to talk about it, it's the local law that regulates land development. It divides a community into zones or districts. Within those zones, land use is regulated, the use itself, the use of the land that is allowed within those zones. The district regulations regulate the size of the lots within those zones. The regulations address the bulk, height, area, and setbacks of buildings in those zones. They could regulate the design elements of buildings. They could regulate the way buildings relate to each other on the ground, the orientation of buildings. They deal with car pedestrian circulation, relationship to surrounding developments, generally how any given development fits in with its surroundings. Those are matters that are going to be regulated through the zoning ordinance. They regulate minimum parking requirements, landscaping requirements. They regulate the building of accessory structures and a whole lot of other stuff. It really depends on the community to decide how detailed the regulations should be in their zoning ordinance. The zoning ordinance also establishes the processes for review and approval of development proposals. So some of the terms that are in the terminology handbook have to do with planned unit development review, site plan review. These are terms that describe processes that the city uses to review development proposals, make recommendations, give approval or deny any given development proposal. And so I'm not going to go through those terms, but understand that when you're talking about PUDs, when you're talking about site plans, other permitting mechanisms, this is the process that the city goes through to accept or deny any given development proposal. There are two parts to the zoning ordinance. The map tells you where the district regulations are in effect. So every place on the map that's in front of you there that is colored with a specific yellow color, the district regulations are going to be the same. And every place that you see a red color, it's a different set of district regulations, but the regulations of those lands are all going to be the same. And then you reference over to the text of the zoning ordinance, and that actually tells you what those regulations are. Development proposals are reviewed for consistency with the comprehensive plan in a number of different ways. As I said, the land use itself, the density of development, the design of neighborhoods, again, the characteristics of the neighborhoods and how buildings and roadways relate to each other. Community character, again, road types and road designs are all regulated through the zoning ordinance. The other local regulation that addresses land use is the subdivision ordinance. The subdivision ordinance is what regulates the division of a single parcel of land into two or more smaller parcels. That's usually referred to as the platting process. What you have when you are finished going through the subdivision process, you have a plat that is actually a map that shows the lots, the streets, the public spaces that are part of the development that was approved through the subdivision review process. It's through the subdivision ordinance process that a community accomplishes other plan goals to make sure that the lots that are created through the subdivision review process are consistent with the minimum lot sizes required of the zoning ordinance in that particular district. Regulates road development. It requires the subdivision ordinance will require the developer to install sewer, water, and stormwater infrastructure, maybe green infrastructure, if that is part of the subdivision ordinance of the community, requires the utilities, and it really dictates as much the overall neighborhood design as the zoning ordinance does. Again, how the pieces of various developments work together. And wow, that was fast. That was 25 minutes. My understanding is that we're going to hold all the questions until the end. We'll respond to the questions at that time. So I appreciate your time for the first 25 minutes of this, and I will hand this over to Mary Rose and Laura.
Thanks, Gary. This is Laura Karstens. I'm the Planning Services Manager for the City of Dubuque.
Hi, I'm Mary Rose Corrigan. I'm the Public Health Specialist for the City of Dubuque.
We've had a long history of working together in terms of public health and planning here in the City of Dubuque. We're going to talk about how we've been connecting public health and also environmental health with our urban planning process. And Gary's given us a great overview of the terminology, so I'll just touch a little bit on the connection historically between health and planning. Urban planning and public health really emerged out of the same urban movements in the 19th and 20th centuries. The development of zoning itself in 1916 was connected to concerns about public health. And community urban planning has always addressed the health needs of communities at some level. Cities typically have police powers and a responsibility to protect and promote the general health and welfare of residents, and planning and using the zoning and subdivision ordinances, as Gary said, is one of the ways cities have done that. We also had a connection between community design and public health. The way our communities are designed can affect health in a variety of ways. You see a number of those on the screen that affect the way people live, work, and play in your community. And over the last couple of decades, there has been a resurgence of interest in the relationship between community design, urban planning, and public health across the country. So we're seeing organizations at every level, local, state, and national, have been creating indicators about the urban environment and health outcomes that help measure the impact of physical, natural, and social aspects of urban health. So let's take a look at what was going on in Dubuque. An economic downturn led our city council to embrace planning and sustainability. We also had a federal Healthy Cities initiative that led to Healthy Dubuque. And since beginning its community health needs assessment and health improvement plan in the mid-90s with this Healthy Dubuque initiative, the city of Dubuque has aligned this process with its comprehensive plan and the updates of that plan. So we've been able to keep these processes in parallel, working together so that the goals and objectives in our plan reflect needs for the health care and health improvement in our community.
Like many local health departments in the state of Iowa and everywhere, we've been doing community health needs assessments for many years. Basically, I would say we kind of did the minimal process as required by the Iowa Department of Public Health, and we didn't really involve the community a whole lot. We did our usual suspects around the table. The Healthy People process back in Healthy People 2000 provided kind of new approaches, goals, and benchmarks that were both state and local, and they did get a lot of publicity. And we also had significant interest from both of our community hospitals who eventually were representing on our steering committee. So back in the Healthy People 2000 days, the hospitals were required to do a community health needs assessment and plan. And with all of the attention Healthy People was getting, they approached our city health department for a potential collaboration. Now, our city health department, I realize, is a little different. Most of the state is based on a county health department system, but on this process, our city and county health departments work very closely together. So they were also brought in, along with a local healthcare coalition, which was a community employer-based organization looking at healthcare costs. Today, hospitals must show community benefit, which is really tied to their federal 990 tax return form. And so Mercy Medical Center here in Dubuque ties their community health needs assessment, which is the whole communities, to how they spend and utilize their community benefit dollars and tracking. So all hospitals are required to do community benefits. So this is the way one of our local hospitals shows how they do that. Also, hospitals are on a 3-year cycle of how often they're required to do a community health needs assessment. And in Iowa, that kind of has changed over the years. For a while, a long time ago, we had to do it every 2 years, and then it went to 3 years, and now it's on a 5-year cycle. However, here in Dubuque, we've kind of decided to stick with the hospital 3-year cycle because they're such an important partner in the whole process for us, and because we see that, at least in public health, things change, and so 3 years isn't any too soon to do a process.
We also want to stress that collaboration, partnerships, and funding are essential for anything that you undertake in terms of these kinds of processes. For example, in the Healthy Dubuque 2000 process, the survey and the staff were funded by the Tri-State Healthcare Coalition, the City of Dubuque, the Dubuque County, and then our 2 hospitals, Mercy Hospital and Finley Hospital. The hospitals, as well as our public libraries, both in the City of Dubuque and Dubuque County, assisted with outreach. We also were able to use data that was coming out of the survey and various presentations to community stakeholders. We also had strong advocacy from the Mental Health Coalition, which has continued to build over time as we've continued this collaborative process. And we also reached out to local organizations for expertise.
as you know, one of the big things about a health needs assessment is access to data, and I think this has improved over the years just in general. Iowa Department of Public Health is able to provide much more easily accessible data than they did a long time ago. But it's important to the partnerships, especially with the hospitals, to partner, because they have, Iowa Health Association, Iowa Hospital Association data that's only accessible, that they can only get. So they can get you a lot of data that public health can't always get. So we use a variety of sources, and including our community health center, or federally qualified health center data, because in Dubuque we do have a community health center. Our planning department has always provided expertise in the demographic area and the census data. They know where to get it and how to get it, and they've been good teachers in that area too. And what we did in 2000 in terms of primary data collection from phone surveys has really evolved to date, and I'll tell you what we've done in our most recent health assessment. As Laura mentioned, outreach and citizen engagement is really a big focus for the city of Dubuque in a lot of what we do, particularly a major comprehensive plan and now the health plan. And I think that's being stressed to a lot of the local public health agencies too. As I said, in the earlier health assessments, we spent a lot of money on community surveys in terms of behaviors and health risks, and they were very expensive. And Laura did mention that it's important to have a budget for community outreach and engagement and marketing and getting input. And everybody in our process, the hospitals, local public health, and the city usually chip in either in hard cash or in resources or tools they have within their organizations to get the job done. Our most recent survey, which we're just about ready to complete, had a web-based monkey survey, if you want to use the brand name, for getting input from the community on lifestyles, attitudes, beliefs around health issues in the community. And it's kind of amazing. Last time we spent, I think, $10,000 or $15,000 on a phone survey. This time, our local hospital had a $100 contract with SurveyMonkey, and we were able to get responses from, well over 1,000 people on what they thought were some of the health issues and how important it was. So just an example of how doing health needs assessments has changed over the years, and why it's maybe even a little bit easier to do it more often.
And as we're reaching out for community engagement, we actually have a community engagement coordinator for our city, and so we have plans on how to reach stakeholders. And Mary Rose has mentioned many of the typical ones: the hospitals, healthcare, social service providers and related agencies, but we've also made an effort to reach out to underserved populations, many of whom may be using or not using some of these services. And so, for example, our Crescent Community Health Center is a way to reach out to some of those populations. This chart is from a 2014 report by the American Planning Association, or APA. It's entitled Healthy Plan Making: Integrating Health into the Comprehensive Planning Process. This report is one of those available for you to download in the file section in the upper right-hand corner of your screen. This particular report highlights 7 communities that have successfully incorporated health into their comprehensive plans. And as you look at the chart, you can see we have 6 cities and 1 county that cover not only the United States and various regions, but they also have a variety in their size and their demographics. So you'll see there's Baltimore County, Maryland, Chino, California, Fort Worth, Texas, Grand Rapids, Michigan, Philadelphia, Raleigh, North Carolina, and then Dubuque, Iowa.
As I mentioned earlier, as we do a process approximately every 3 to 5 years, and the times on here usually end up with the publication date. For instance, the 2011 plan we actually worked on mostly through 2010, and the plan we're soon to put out we worked on pretty much for about the past year when it comes right down to it. But you can see how listed through here there is some overlap in some of the health needs identified and some new ones popping up. And I think that's okay if you have a few repeaters. And even on here, I know in 2011 air quality was mentioned, and it is again in 2015, but it also shows our progress that in 2011 was the first time air quality was mentioned in our comprehensive plan, and so we actually kind of kicked it into action, and now we're doing some things. It's still a need, and so it got a little bit higher up on the list this time. So that this kind of shows evolution of how things happen over time. This is just an example of what turned into be community engagement. We got a big headline when we published some of our data from our early assessment in 2000, one of the first ones we did, and it got some headlines. The good thing about this is that it really caused some citizens to kick into action, and a pretty aggressive task force was formed. And out of this, we still have a task force running today, you know, the Area Substance Abuse Task Force. And so some of these things can be long-lasting, but sometimes it takes a headline to get the community involved, too. One of the things that we've been working on recently is kind of in this most recent community health assessment is the concept of healthography, about how where you live, your location in your community, your state, whatever, affects how long you live, and it affects your health. And we've really, in this latest process, incorporated one of the health planners over here in Laura's department, who is very savvy in GIS, and we also have a city and a county GIS person, but we mapped a lot of our data to show areas of the city and county where specific health conditions were more prevalent, and also some social indicators of health, such as income and educational attainment, and then we even overlapped some of them and showed, you know, areas of highest need. So when Laura goes to update the city's comprehensive plan, these kind of mapping strategies are going to be really useful, since the planning is a lot about land use, neighborhoods, those kinds of things. So GIS has become part of our local planning efforts also.
Another part of our local planning effort is sustainability. The city of Duke has adopted this sustainability model. It has 12 principles that are focused in 3 areas: economic, environmental, and social cultural aspects of our community. Now, you could link all 12 of the principles to a healthy community, but there are several that specifically address community environmental health. For example, on this slide, which focuses on economic prosperity, the ones that relate most directly to health are resource management and community design. In terms of environmental and ecological integrity, the sustainable Dubuque principles that relate closest to health here would be reasonable mobility and healthy air and clean water. And finally, under social cultural vibrancy, those that we can relate directly to health are green buildings, healthy local foods, and of course, community health and safety.
And I will add that each one of these 10 principles, we are always looking for indicators to measure them. And measuring sustainability is not always easy. I think one of the major successes for public health and for me in this community is the last principle wasn't always there. This was just added about a year and a half ago, and it was sort of like a major victory for me to get community health and safety on there, because it gives us more publicity, and it also gives some of our organizations in the community, they are coming up with some indicators and benchmarks to put under this principle that they themselves can work on. So it's kind of a bonus to our community health needs assessment, and it gives us another direction to follow. So we have these plans. You know, what do we do with them? Do we let them sit on a shelf? Well, hopefully not. We like to say that the plans help with funding and other opportunities, such as implementing community health improvement models. For instance, some of you may have heard of the ACHIEVE model through the CDC, the Community Transformation Grants. Those were, we went after those grants and programs based on our last community health needs assessment that says we needed to address obesity and physical activity. The development of our County Mental Health Alliance was kind of based on the community health needs assessment several years ago, several needs assessments ago, I guess you could say. And with all of the talk about healthy behaviors and prevention of chronic disease, we like to point our community-based organizations and even businesses back to our community health plan to say, these are the top needs, this is what you should be working on. It's kind of the collective impact model that if we all follow the same plan, we're going to have much bigger results as a community. So our community health needs assessment doesn't necessarily get down into the weeds into specific models and programming being implemented, but rather bigger concepts, and we're moving towards you know, the environmental change and policy development kind of model. Like I said, the plans do meet the hospital requirements for their 990 forms, and by the time we did the community health needs assessment post Healthy People 2010, we were sort of on kind of automatic pilot, like, okay, let's get together, we got to do this again, and all of our partners, it's pretty much assumed that the hospitals and public health work together on this effort. So it's becoming part of our culture, that's how we do it, and everybody realized the benefits of working together on it.
And so you can see, as we begin implementation and evaluation and continuing those processes, maintaining those partnerships over this long term has helped us really establish the groundwork for future planning and health activities and initiatives. You can see these range from everything from a health center to infrastructure improvements to code improvements, really a lot of the things that Gary talked about. And as we continue to look ahead, planning and public health remains a strong force in the comprehensive plan, reinforced by that 12th principle in our sustainable Dubuque model. And as we begin updating our 2012 plan, we're looking for, again, that underrepresented sections of our community to get those populations into the process, looking to make the plan easier and more relevant for people. We're also wanting to make this an opportunity, again, continue to talk about how planning and health are so related, making sure that we're getting incorporating that into the planning process so people understand the relationship between our comprehensive plan, our sustainability model, and making health a primary focus of our planning.
You know, we've all been hearing a lot about health in all policies. Some of us are implementing that. Some of us are learning about it. It's an awesome topic, an awesome field, and I really think that doing a solid community health needs assessment and health improvement plan is really the first step in a community moving towards health in all policies concept. I think now that we're just wrapping up our latest community health needs assessment, Laura here is a little bit excited because a lot of the health things are completed or will just need slight updating when she embarks on updating the city's comprehensive plan. But also the notion of the health and all policies is really going to come through between the goals we've set up and then also through using our sustainability principles and goals. And so I think if communities can leverage their health planning process as a way to introduce and get the community used to health and all policies, it's a really good opportunity.
So we're going to wrap up here with these take-home messages. You know, partner, don't do it alone. Yes, funding is critical, and as is outreach and engagement. And be proactive. Don't expect people to come to you. You've got to meet them where they are.
And one thing you can also say is that sometimes another organization may have some funding to do this. For instance, hospitals now are kind of setting aside a little bit of money to do their health needs assessment. So you can partner with them as we did. Sometimes a city or a county undergoing a comprehensive plan has some money budgeted for a lot of that activity. So jump on the bandwagon, especially if you're willing to do a little bit of the legwork in putting together some of the data. And like I said earlier, I realize that most of the state is based on county health system, and in Dubuque we're a little bit different. We still partner, our county and health department, city health department work hand in hand on this. But that doesn't mean a county health department couldn't reach out to a city within their county, contact maybe some of their planners and say, you know, where are you at with your comprehensive plan? You know, can we use some of the information out of it? Are you going to update it? Those kind of conversations. I'm sure they would welcome anything you might have to offer from your county health needs assessment.
So we're at the point, I think, where we're going to take questions for all the speakers. This slide shows our contact information. Mary Rose and I are happy to try to answer any questions or provide additional information. Mary Rose does have the county health assessment handout.
Yeah, this is the one we did in 2011, and it's a synopsis of our goals and stakeholders. And it's an easy way to see what we kind of did. It's not the full publication. I do encourage you, if you're doing a community health needs assessment, to do kind of a executive summary kind of document. It does help people understand what you're doing a little bit more than reading the whole entire plan.
So again, that's another option for you to consider under the file section in the upper right-hand corner for download. And that's it.
All right. Well, thank you very much to all of our presenters. We greatly appreciate you spending some time with us. So now is the time that we will take your questions. So if you do have questions for Gary or Laura or Mary Rose, you can feel free to type those into the chat tool, and we will get those answered for you. Just as a reminder, in the top right-hand corner, you can download any of those files just by selecting them and then clicking download, and they'll download right to your computer. Also, while we're getting our first question here, you will be sent an evaluation that will open automatically in your browser. So if you would take a second to fill that out at the conclusion of this webinar, we would appreciate it. Any questions? The first question is, are planners interested in potentially revising Chapter 188 to specifically mention public health?
Well, that's a great question. I was wondering about that as Gary was going over the listing. I don't know if the Iowa chapter of the American Planning Association is, although I know that the Iowa APA chapter is working, has some grant funding and is working on public health, so it could happen.
We did a similar presentation like this up in Madison. It's been about 1.5 years ago, and the state of Wisconsin had a grant and an effort to educate, partners about public and health integrating too. So I kind of wonder if they've done anything in Wisconsin. Maybe a place to look.
Yeah.
Yeah. Mute on the phone does not help me get my voice out. Unmuted. I was just up in Madison for their APA conference last month, and as far as I know, they have not made any revisions to their code, and I don't know. We really haven't had any conversations that specific here in Iowa about going back in and amending Chapter 18B of the code for public health. There was a lot of politics surrounding the adoption of 18B at the time, and I think, I guess I would say that this might be too much of a generalization, but I think the planners have been content to just lay low on 18B for a few years because of the politics that surrounded its adoption, and then a couple of years in a row, subsequent attempt to repeal it. So the long and short is no, there hasn't been any efforts to amend it. Whether there are any in the future is a good idea.
All right, thank you. The next question is, Mary Rose and Laura, you mentioned that alcohol abuse was a concern that came out in Dubuque. Did public health and planning work together to address alcohol density?
I don't know that there was any specific things done in terms of zoning or planning for that, but what we did end up doing was a lot more education, and the local substance abuse council was formed. I know it had a big impact on the colleges' programming. We have 3 local colleges and universities, and they really improved their efforts on student alcohol use and things like that out of the process. I think people became more aware that the norms in Dubuque were not necessarily the norms everywhere else, and were not necessarily healthy. So it was a baby step. I think what's happened over time is there's been some natural density correction just based on economics. Quite frankly, yeah, we used to have a tavern about every couple blocks, but many have gone by the wayside, and so there is a little bit change in focus in the neighborhood development and some of the neighborhood improvement things we've done.
We've just made just some minor changes in our ordinance. I would agree with Mary Rose. It was largely education for those corner stores that tended to be bars. We did change the regulations so that in some cases they weren't prohibited, or in other cases they had to go through an additional review process. But I think a lot of the attrition has been as the economy's changed and as people became more aware of many of these programs Mary Rose has mentioned.
Okay, it looks like we have a couple more questions coming in. Some long questions. Okay, a lot of what is being discussed concerns cities. Future discussions of involving the unincorporated areas of the county.
Well, I know our last community health needs assessment, I said it kind of sparked us to apply for the Community Transformation Grant in Iowa, and that's, based on the whole Heark and Wellness funding. Our county applied for that grant, and many of the activities, a real effort was made to do outreach in, at least the smaller communities in Dubuque County. That was definitely a focus. What we have found is, although there are different smaller towns and unincorporated areas in the county, a lot of them, those residents still come to Dubuque, the city, for their health services, their shopping, etc. And so that's still a lot of the way we get our message out. But there always is a constant effort on, what about the smaller communities? In fact, we did have a community garden project in one of the very small towns, Epworth in Dubuque, and a greenhouse going on in that community. It wasn't just like an urban garden effort in Dubuque. So, and also along with our bike racks and trails assistance happened in some of the smaller communities too, thanks to the outreach that the county did around that grant. So it's always in our minds. Sometimes it's a little challenging, but it can be done if you work with the other organizations.
Great. All right, here is the long one. Would ISU be interested in incorporating these examples of planning, public health collaboration, and terminology into the curriculum for planning students? Likewise, do we need to talk to other public health academic partners like the University of Iowa College of Public Health and Des Moines University to do some cross-pollination of planning concepts and processes in the Master of Public Health Community Health Practice curriculum?
Great idea, Janine.
Yeah, I think it does. I think it does. It has started to work its way into the curriculum now, although it's more on what I would say a course-by-course basis. It hasn't been, up to this point, it hasn't really been an active focus, but it definitely could be in the future and is likely to be in the future. It's interesting, within the last 3 or 4 years, I have been the major professor for a couple of MPH students from DMU who were interested in looking at the interaction between smart growth and public health and the policies concerning walkability, the whole gamut of health-related land use issues. So it's definitely on the radar. At least I can say it's on the radar of a few people down at DMU who have pointed students up our direction. So I think that's promising. I think it's very promising.
I know for me, I've inquired at the University of Iowa College of Public Health if they have health in all policies curriculum or a class. And the answer was basically, they touch on it maybe for a day in one class, but they don't. And I think I don't know how much that model and concept is being incorporated yet into MPH programs, but that would be a good place to start. The other interesting thing is when we did our sustainability planning here and created the sustainable principles to track and monitor, we engaged the University of Iowa Urban Planning College. I don't know if that's technically the name, and those students were here, and as we were doing it, I said several times, we should have had the College of Public Health in on this too, because as you saw in those principles, many of them were directly related to public health data. So, you know, as we go down that path, I think involving interns is a good start to some of that too.
Mm-hmm.
The other thing I really didn't mention either is as we've done our community health needs assessment, we've always had a steering committee that kind of kept the process moving, and the steering committee was made up of a representative from each hospital, the city and county health department, our local VNA, which is really our public health nursing arm, and our community health center. So we had a nice mix of people having input and being in charge of specific topic areas. So sometimes if the partnering organizations know they have a say in the final product and how the whole process goes, they're much more likely to be involved too, and that it's a kind of an equal steering committee participation model.
Great, thank you. Do we have any other final questions? Looks like we have a comment. Janine says, agreed, so many opportunities, so little time. Back to the point made about collective impact. We need to all make continual steps on health and all policies dissemination and keep pulling in the same direction.
Nice comment, Janine. I agree too.
Here.
Yeah.
Right. Well, it looks like that is all of the questions that we have. So I just want to take a second to thank our presenters. We greatly appreciate you sharing your expertise and experiences with us today. And then I also want to thank all of the participants for joining us today. If you guys do have any questions or comments, please feel free to share those on your evaluation. Also, the link to the recording will be sent to you, as well as the links to all of the handouts that were provided in the webinar and the slides if you are interested in those. So thank you very much for joining us, and enjoy the rest of your afternoon.